Good evening and Ramadan Kareem to you all. I'm your host, Bara Abdallah, here to bring you a great line of segments featuring local talents, initiatives, and events from around the kingdom as we celebrate the holy month. So stay tuned. We'll be right back. Ladies and gentlemen, skincare is always the main subject, and during Ramadan, especially as we get our skin ready for some skincare talk with no one than other, Dr.Ranya herself. Dr. Ranya, how are you?
Hi, Ramadan Kareem.
To you too as well. This has been a great month so far, definitely.
Alhamdulillah.
And now all the tips we've been hearing, and we can't wait to hear yours as well. And may I say, that's a beautiful style right there.
Thank you very much.
Really
Thank
appreciate
you.
that. The Ramadan vibes are all over the place right now. And speaking of that, you know, a lot of people right now are looking into the issues and even some ways to take care of their skin during Ramadan. They get dehydrated, you know, they see their skin's getting like a little bit crispier. What should we do? Okay.
First of all, I would always start from saying that the skin is the biggest organ in your body. So it's a mirror. Whatever you eat, it will reflect. Whatever you do, it will reflect. It's like a mirror. So first of all, start eating healthy. That's very important. You know, our culture during Ramadan, we go more into carbs.
Yes.
But don't forget vegetables, fruits, to make it more colorful. It will help you a lot to make your skin glow and to nutrient your skin. Drink water. This is very important. And again, sleeping well is very important as well. For ladies, please don't forget to remove your makeup.
Yeah.
Please don't forget your skin routine. This is very important. And I would always say sunblock is even while cooking.
While cooking?
Yes.
Okay, that's a new one.
Actually, for you, even during the blue lights, during using your phones, these things, you know, all the new studies have proven that even the blue light can make your skin looks older.
Give me a second. Director, you heard that? Yes. No, we got a tip right here.
Okay.
This is amazing. So pretty much take care of our skin because of our phones, the lights, and all of that. I've been here for a long time.
Yes.
So what should I do? Should I get some kind of a cream? Should I just make sure that I have enough water around me?
Come for a facial.
I'll do that. I'll just come for a facial. Schedule me in. But you know, so eat healthy, vegetables, fruits. If I would say I want to focus on a certain vegetable or a certain fruit the most, that will actually be like more of the skin rescuer or skin enhancer, what would that be?
You will go into antioxidants. So think of vitamin C.
Oranges?
Oranges, berries.
Okay.
Kiwis.
Kiwis.
Lemon.
Wow.
Yeah.
Wow.
Tabbouleh is a very good option.
I love tabbouleh.
Tabbouleh is a very good option.
I love
It
that.
also contains lots of zinc, so it will help you also for your nails and your hair.
Wow. Okay, so oranges, vitamin C, and tabbouleh. I love the combination.
Do that.
Now, from making sure that we have enough hydration going on with our skin, let's say we want to take it a step further. We want to have a beautiful skin. We want to make it shine even during Ramadan. What should we do?
You know, I always explain for the patient that 60% of taking care of your skin, you yourself is doing that. But 40% depend on your routine and your doctors.
Okay.
So if we will go to doctors, I would always recommend a facial. It's a very simple procedure that will help you to have a good time. You will enjoy it, and at the same time, you will indulge your skin. You will indulge having a good treatment for your skin that will help to exfoliate, to get rid of dead skin, the excessive oil, and to stimulate the blood circulation, the lymphatic drainage. So you are just simply detoxifying your skin.
Wow.
If you do it in a good place and in a good way.
Amazing. I love that. Again, schedule me in.
Inshallah.
Inshallah. You know what's very interesting right now? It seems like a lot of people are not noticing it, but it seems like it's very important, like where a lot of patients or clients or people will go for a dentist for, I would say, a dental checkup. It seems like right now we reach to a point we need to go to a dermatologist for a skin checkup. You know, whether you feel you have any problems or not, but it seems like there's a lot going on today. As you said yourself, phones, frequencies, food, and all that's surrounding us, the environment, the air quality, and all of that is all pretty much, like say, piling up on our skin. So even if you have nothing going on, still go to a dermatologist at least once or twice a year?
Yes. I'll tell you a very simple example. My husband is a dentist,
Yes.
so I'm always comparing with him. I'm always telling him, people come for scaling, but they don't come for facials. Actually, it's the same. Scaling, yes, it's exactly the same. Scaling is the way of getting rid of whatever have happened because of your food, because of your habits, because of your smoking. So it's just a good way to clean your skin, your teeth.
Right.
Why not to have facial the same regular way? It's a very good way to boost your skin even.
Wow, wow. You just changed my mindset right now and how I see dermatology and skin, because a lot of people will go to it either for treatment, but mostly even now for aesthetics.
Very, very, very. But that's why during maybe the last 2 to 3 years, a new thing have happened. Skin boosters.
Skin boosters.
Yeah.
What is that?
That whatever injection you will use, mainly depending on hyaluronic acid and extra ingredient, that will help to invest your skin for the coming 3, 4, 5, and maybe more years. Why? Because with the time we are getting older.
Yes.
Yeah. And the hyaluronic acid or the collagen will break down. You will have more sagging, pigmentation, weak skin, laxity. So why not to treat your skin, not to change the shape of your cheeks or the volume or whatever, only to maintain your skin. That's a skin booster.
Wow, there's a lot going on.
Yes,
There's a lot going on. Skin booster, again, you know, so right now we have more than just the dentist. We have the dentist and dermatologist right now on our schedule every year, annually, going there once or twice just to make sure for a checkup. I mean, people take their car to the workshop more than would take themselves to the hospital or to a specialist.
And again, don't forget, your skin reflecting. The first thing for me to notice in you is your skin.
Right. Right. What about my skin?
You're looking great.
Thank you. Thank you.
In spite of the blue light.
Well, yeah. Well, you know, the director now, Mr. Mustafa, is hearing this. He will take notes. Don't worry.
Okay.
We are all taking notes right now.
Inshallah.
Now, all this has been going on during the month of Ramadan, the blessings of Ramadan. Now, in your clinic, I'm sure you noticed some kind of changes going on, right? People coming in, and you know, is there a rise of number, or you know, if it's slowing down? What do you notice in Ramadan during what's happening in your clinic? Do you see that certain things are pretty much increasing, decreasing? What's happening?
Alhamdulillah, alhamdulillah, we are doing good.
Alhamdulillah.
I think, especially heading toward Eid,
yes,
you will have lots of patients or clients, we would say, coming for extra glow, extra shiny skin, glowing skin, or maybe a bit of Botox or filler.
Yeah, I mean, what is interesting is like we always make this kind of talk and comment when you see a person in Eid or glowing. It's like, man, you really prayed. Tasha'u bil iman, man, your faith is getting stronger. I love that. I love that. So, but no, actually, they visited you. But still, that's beautiful. That is beautiful. Now, from skin to hair. Now, both male and females, right? Now, we're exposed to so many things, right? Again, social media, comparing yourself, the mental stress we're going through right now, the dopamine levels are always high, bad nutrition, we don't move a lot. So now you can see a lot of males, I would say, because you know, knowing what's happening around me in my vicinity, is that people are starting to lose hair, not even in their 40s, but even in the 30s and 20s.
Even 20s.
Even 20s. And even for females and all of that, we're noticing that there's a change right now. A lot of chemicals they're using in their hair and all that, just because they want to blending, whether it's psychological, societal, reaching to a point when they reach to their 30s, nearing up to their 40s, they notice the quality of their hair is changing. It's not what it used to be before. From just looking cool to now just trying to save it. So now for hair loss, I mean, what should we do to at least maintain it during Ramadan? What happens during Ramadan?
Again, for me to start with, I would say prevention is better than cure.
Okay.
So start with the good nutrition, again, because whatever you will eat, it will be reflected. So for example, I think all my, if a patient comes for a hair loss, the first thing I would do is to do a blood investigation, just to make sure that, for example, his iron level is normal, his thyroid is normal, his zinc, vitamin D, and you can see lots of deficiencies. Number two, always start with taking supplements if you think you are not that healthy picker, for example.
Okay.
So multivitamins, now you can find it everywhere. Decrease the usage of hair dye or the blow dry, the straightener, which is much more dangerous.
Wow.
So this is a very important thing. Now genetic, we cannot do anything about genetic factor because at the end it's in your blood, it's in your genes, we cannot do anything. But if you feel that you've started to lose hair, and especially in the male pattern baldness, then please seek a dermatologist to start a treatment. Now we have first of all, the mesotherapy, which is a cocktail of vitamins and amino acids that will be injected superficially to help your scalp to be more healthier, to get a good hair growth and to prevent hair loss.
Okay.
If that doesn't work, then go for PRP.
Okay.
And the PRP, it's your blood. We are getting growth factors from your blood and re-injecting that in your scalp. All the studies have proven a very good result for androgenic alopecia, especially with PRP.
Okay.
And the new trend, again, we are talking about everyday evolving medicine.
Right.
So the new trend now is to add some vitamins like the biotin to the plasma itself. So like you are doing 2 sessions in one. And the third is using the stem cells or the fragmented stem cells like Regenera, which I'm just getting a stem cell that will help to divide with the time to be new hair follicle in the affected area. So techniques have changed.
Right.
No need to wait until you've reached a way that no backup.
Right.
You need to start early.
Start early.
Yeah.
Love that. Again, schedule me in. That's a lot. Now we've got skin and hair going on. So, but it seems like a lot of people just go to the extreme case of hair transplant.
Yeah.
Even though when they still have some volume going on, but the moment they see that the hairline is getting a little bit further back, their forehead is getting bigger, and there's more space over there. Is it extreme to go for hair transplant when your hairline gets a little bit further back?
It's very important to understand androgenic alopecia means it's baldness. It will happen at the end. So sometimes it's better to go for a hair transplant plan before starting anything, or even before waiting for, as you said, the hairline is getting much
more space.
So it's better to start early.
Okay.
Again, it's the doctor who decide, and don't forget, with the time, you need to have a donor to have a hair transplant, and the donor area is always the back.
The back.
Sometimes people start to lose even the donor area.
Oh, wow.
So that's why they need to start with the hair transplant.
Oh, as soon as possible.
Yes.
Definitely.
And you've said we've started to see androgenic alopecia even at the age of 20s. Actually, I have cases 15 years old.
What is going on?
Yeah.
What's happening? Is our genetics changing? Is our DNA changing? Is it
our food?
Is it our food? Is it TikTok?
Is it the level of the stress these teenagers are living?
Wow.
Yeah.
Wow. Stress puts a lot, whether it's studies, their parents.
Whether corona.
Oh, man. Oh, wow. That changed a lot.
Yes.
I think I'm going to read some studies about hair loss.
Actually, we have.
We do have.
Yes. You've been through BDLA. We have studies about corona and hair loss.
It's crazy.
Yeah.
But we're not talking about the virus itself. We're talking about the side effects of living in isolation and all of that.
Of course.
It's crazy. Hopefully we won't see more advancements in that case
Inshallah.
in the future, and that's pretty much we contained the measurement and everything going on with the precautions. Now, that's with hair loss. There's something we've been hearing a lot about, the derma roller.
Yes.
What is that?
Okay. Simply, it's needles over a roller.
Okay.
Over a wheel.
Okay.
But to be honest, a derma roller is talking about a technique that's called a micro needling.
Okay.
A tiny needles.
Sure.
So to understand what's happening with the derma roller, because the type of it have been evolving. It started with as a derma roller and then a derma pen, and now we have a nanopore. It's all with the microneedling. You have two techniques. You are doing two techniques with the derma roller. You are creating a micro channels that will help the skin or the scalp to absorb whatever material or ingredients you are applying to your skin after the procedure. So the micro channels will help to absorb better nutrients to a deeper level.
Wow.
For example, if you are using it for wrinkle, then you would go deeper. If you are using it with mesotherapy or plasma, you will have it deeper, so you will have a better results. This is the first explanation. The second explanation, microneedling itself, this mechanical effect, it will help to stimulate your collagen. It will wake up your collagen. It will increase the blood circulation at that area. And that itself will help to tighten skin, to improve the blood circulation. And this will have a better results. So simply, it's a very good way to help with wrinkles, help with the stretch marks, with hair loss, with pigmentation, with the glow, with tightening. It's a very good procedure in dermatology.
We are definitely going to visit the dermatology section and see ourselves with what's going on, because like you said yourself, we need to take care of our skin. It's the biggest organ we have in our body. It's the mirror, as you just mentioned earlier.
See, I'm happy. You are having good information.
I am. You changed my mindset on all of this, honestly, because we just go to, when it comes to dermatology, we just go there when we have a problem.
Yes.
But now you're telling us, you know, to avoid the problem.
Like itching, redness, dryness, acne, that's
fungal, you know, fungal
Yes.
infection, all that kind of stuff. So now I guess it's time to not only just wait for something to happen, we have to prevent it. Well, you know, Dr. Ranya, this has been a very informative and entertaining, yet a blessing of a talk with you here today.
Thank you very much.
Bahrain Now. It's been a pleasure, and I know it's not going to be our last time here.
Inshallah.
Definitely.
Inshallah. Thank you very much.
Most definitely. Well, ladies and gentlemen, that was Dr. Ranya and her beautiful information when it comes to skincare and hair, all that took place on Bahrain Now. Ladies and gentlemen, this brings us to the end of today's episode. Don't forget to reach out to us on our social media accounts shown below for any inquiries. We love hearing from you. Thank you for watching, and we'll see you in another episode of Bahrain Now. Till next time, Bahrain, good night and God bless.